I've actually been asked to make this presentation that I'm giving today to several nursing groups, hundreds or maybe even thousands of nurses at this point. And they need it. They need the support, and you'll see why. When asked what the stressors are for them, the major stresses for nursing, work overload is one of the major ones, the top one that's given. That's not really surprising, and I don't think it's exclusive to nursing either. A lot of people would say work overload is the reason for their stress at work. But patient to staff ratios are very important, and we'll talk about that in a little bit. Time pressure, also not surprising, especially when you consider that there are timed medications, they're running from room to room, they're having to chart for a lot of people at one time. Lack of social support at work. A lot of times they feel like they're off on their own doing their job, and they have coworkers also running around doing their jobs. Exposure to infectious diseases. Now, this is not something that people in other occupations are necessarily going to be impacted by, but obviously nurses would be. And likewise, needlestick injuries, which is a particular type of exposure to infectious disease. Workplace violence or threats. This was incredibly shocking to me. When I started doing the research to make this presentation to the first group of nurses, the number of nurses who reported workplace violence and threats, both by other coworkers and by patients and the patients' families, it was shocking to me. In fact, a lot of nurses reported workplace bullying among their coworkers. They said that 45% of other nurses bully them, 41% of hospital administrators or managers, and 38% of doctors. Sleep deprivation. This one has always been really surprising to me, that the people who are charged with saving our lives, nurses, doctors, police officers, firefighters, work these strangest schedules of anybody I know. They will often work 12 hours on, 12 hours off. Or they'll work 6 weeks of night shifts and then 6 weeks of day shifts, which totally messes with the circadian rhythm. And there's so much research out there about how our bodies heal themselves when we sleep. Our brains store important information in our long-term memory when we sleep and prune those neural networks that are no longer being used while we sleep. It's really, really important to get a good night's sleep, and yet these people, these carers, are not getting the sleep that they need. Role, ambiguity, and conflict. What are they responsible for? What are social workers on the job responsible for? What are the doctors responsible for? What are the administrators responsible for? Understaffing. This is a major one we're going to get to, the patient to nurse ratio. It's incredibly important, and it's really increased in recent years. Career development issues was another one. And difficult or seriously ill patients. Now, again, if I were doing the research, I would have separated these out, because you can have really difficult patients who are not very ill, and you can have really ill patients who are lovely to deal with. They're wonderful human beings, and they're not difficult at all to deal with. But it's reported, they're reported together. So here's what we really need to talk about here, though, and it's really important for hospital administrators to know this. Patient satisfaction is directly correlated with nurses being satisfied with their job. Direct correlation. And in fact, for every 10% of nurses at a particular hospital who feel unsatisfied with their job, patient satisfaction decreases by 2%. And for each additional patient per nurse, the risk of nurse burnout goes up by 23%, and their satisfaction goes down by 15%. So patient staffing ratios are incredibly important for that perspective, not just to keep the nurses happy and to keep them on the job, but to keep the patients happy. Likewise, there's a danger to nurses feeling exhausted and burned out and overworked. 11% of nurses admitted that they've made a mistake due to being fatigued. That's really a startling statistic. More scary, perhaps, is that for each additional patient in a nurse's workload, the risk of patient death goes up by 7%. So let's put all those figures together from these two slides, that for each additional patient, a nurse's risk of burnout increases by 23%. Her satisfaction goes down by 15%, which means a patient's satisfaction goes down and the risk of patient death goes up. It's a really serious problem for all of us, not just for nurses. Everybody gets sick at some point in their lives. And for those who don't, amen, good for you. That's great, but most people are going to have an encounter with a nurse in a hospital at some point. 41% have considered changing hospitals due to stress in the past. Over 40% report worrying about patient care and making a mistake due to their fatigue. Over 60% report nurse burnout. 85% report that their job makes them exhausted overall. And almost all of them, 98%, say that their job is physically and mentally demanding. Half of nurses have considered leaving nursing. And here's the important piece of information. 27% of nurses report working more hours today than in 2017. However, 46% report an increase in workload, which is the patient to staffing ratio and all the charting that they have to do with the electronic health records, paperwork. So all of these data taken together paints a very scary picture for the safety of patient health. Nursing did not make it onto that top 10 list, you noticed, of the most stressful professions. It was number 27. However, we have a nursing shortage, and over almost 500,000 nurses have already left nursing due to stress. Something has got to shift. Something's got to give here. We've got to give these nurses either lower patient to staffing ratios or, I would say, better coping skills, which is why some of these nursing organizations have brought me in to speak with them so I can teach them tools and techniques where they can go take a 2-minute break in a break room, and actually come back to a place of calm and center. The reasons that they've left nursing, 27% feel overworked, 16% don't enjoy the job, lack of patient time is 12%. That makes sense. They got into nursing because they want to help people feel better. They want to help these patients feel well. And yet they're having very little time to spend with each patient. They're running from room to room. They're charting. They're measuring out medication. The paperwork and electronic health records, 15%. A lot of them have left due to that. Good for the people who are ready to retire or want something new. That's good for them. But the other 15% are those people issues. And so we've got high workloads, we've got limited staffing. I learned something when doing this research, a term I'd never heard before, voluntary overtime. Have you ever heard of that? I don't think anybody works voluntary overtime, but apparently it is an accepted phrase used in the nursing profession. Voluntary overtime. Just stay and help because people need help. That is not a reasonable expectation. And in fact, in this survey, 1/3 of nurses had emotional scores that qualified as burnout. So a real problem.